There's always a danger you could lose insurance. You could always lose your job. Something can always happen. And I've been through enough periods. I've been uninsured more than once, and things have changed more than once. Finding all the new doctors, a couple of prescriptions lapsed, which is not a good thing to have happen. It's like every time you change insurance, you change doctors.
At the health center where I work, we take 52 different health plans. So you can imagine the nightmare of paperwork that involves, because that means there's 52 different formularies, that means there's 52 different specialty networks, that means there's 52 different sets of rules.
I'll see patients that I haven't seen in a long time and I'll ask what happened, their insurance lapsed, they had to change their job, whatever the case was, and they weren't able to follow up with their chronic conditions. And this leads sometimes to worsening of their hypertension or their diabetes, for example.
My name is Gustavo Rivera. I'm a state senator for the 33rd District in the Northwest Bronx. I'm also the ranking member in the Health Committee in the Senate. One of the main reasons why the New York Health Act is necessary is precisely because there is so much shifting that happens when people are trying to look for better coverage. They're trying to figure out what plan best fits them. If they change jobs, they also are changing their health care plan. This would actually eliminate the need for all of that.
The New York Health Act would be fabulous for me and for my patients because it would eliminate all of the red tape. Really, I spend almost as many hours with insurance bureaucracy as I do hours seeing patients. It would free me up to do much more medical care. It would free my staff up to do much more medical care.
We won't have to worry about insurance changing. We won't have to worry about doctors taking different insurances because they're not getting good reimbursements from a particular insurance company. We won't have to worry about insurance lapsing for any reason, changing jobs.
I decided to support this bill because I believe it's the only way for us to actually move forward in the state of New York to provide as much comprehensive care to as many people as possible, particularly in the current federal climate.
Yeah, I have a job now and that's great, and I get an insurance stipend to buy my insurance and that's great, but I mean, you just don't know what's going to happen to you.
We have to make sure that we get it done, but to do it, we have to get more state senators on it, and that's why I would ask every New Yorker to figure out who their representative is and go ask him or her, why are you not a supporter of the New York Health Act?